All right. Great. So thank you for that question. So this is being recorded, and you'll have access to it afterward. I also want to let you know that you can make your own recordings of my voice today. So I'm going to lead you through some practice exercises, mindfulness exercises today. And at the end of these sessions, I almost always get the question, can you make these mindfulness recordings available? So what I'm going to do is just invite you at the outset to record this. You can do it using the voice memo app on your phone. Excuse me, I'm getting over a cold. I grab a cough drop. So that's an example of me taking a pause. All right. So what a way to begin. You can record these sessions, these exercises today using the voice memo app on your phone. This is what the app looks like if you have an iPhone, and then you can just hit record when you're ready. All right, so now diving into this rationale. So you've probably heard of hustle culture. So this way of continuously being in motion, working harder and harder as a way of getting ahead, because that's what it feels like we're being called to do. And that's what lots of people around us are doing. It's actually worsened during the COVID-19 pandemic. So research has shown that virtual work has led to longer and longer work hours. More of us are working on the weekends than ever before. And work and life no longer have the same kind of separation that it once had when we were going into the office or into the classroom. More things are being offered virtually now, meaning that we can do them anytime, anywhere. This effect is stronger for women in historically minoritized groups. Research has shown that folks that are in these groups, and especially at the intersection of these groups, are working longer and longer hours, and women are responsible for more household responsibilities and childcare responsibilities during the pandemic because of school closures and kids being out sick. And so they're working harder than ever before. We also know that overwork, so working more than 55 hours a week, is associated with lots of negative health consequences. So these are just a few. So overwork is associated with poor sleep, inadequate exercise, an unhealthy diet, excessive drinking. There's a 35% greater risk of stroke among people who work more than 55 hours a week, greater risk of heart disease, other occupational diseases, and also premature death. So this is a serious problem, and yet it is so normalized by our culture. And so what I have been thinking about a lot during the pandemic is how can we pull back? How can we pause and be more intentional about the work that we take on? This is a challenge even for me, something that I'm thinking about in my own life. And I'm working with a lot of healthcare providers who are experiencing this overwork as well. And I know that it's impacting a lot of students too. We see some students in our outpatient clinics and also on our inpatient unit who are feeling stressed and burnout from this overwork. Overwork isn't the only stressor that people are experiencing right now. And I'll ask you to put in the chat anything, if you're willing to share, any kind of situation that's creating stress for you. It may be midterm exams coming up, work-related stress, financial problems, relationship issues. But if you don't mind sharing, you can put this in the chat, and you're also able to share there if you want to send it to the host and panelists or everyone. But if you feel comfortable, just put something in there that causes stress. All of the above. Great, thank you. Someone saying family issues, midterms, long distance relationship, making time for everything that they have to do and everyone, recovery from surgery, yeah, applications, internship applications, in the case of some, health issues, yeah, adjusting to being at a four-year university for the first time, working on applications, multiple obligations, parenting, work, and school, health issues. I raise this because, and I think it's important to share, because a lot of folks here can identify with this. We're all facing similar issues. Yeah, relationships, the costs of things going up. All right, and so now I want to think about, we're here at the stressful situation part. What emotions does this bring up in you? Just thinking about these stressors or dealing with these stressors. So I gave some examples here. Worry, anxiety, sadness, frustration, perhaps. Could you put some emotion words in the chat? Ways that you feel when confronted with these stressors. I'll give you a minute for typing. Yeah, thank you. Anxious and frustrated, exhausted, overwhelmed. Yeah, a lot of overwhelmed here. And jittery, that's a good word. Overworked. Yeah. Overwhelmed is a word that I hear a lot in my line of work. Pressured. Yeah, a lot of pressure to perform and do well, handle all these competing responsibilities, and other overwhelmed. Great, thank you for sharing that. All right, so stressful situations can cause us to feel emotions. And given the stressors that you all identified, feeling those emotions that you raised makes perfect sense. It makes sense to feel that way when facing a stressor. All right, and then we think about, okay, when you feel that way, what do you do or not do? Some of the things you may do may be helpful to you, and some of the things that you may do may not be helpful. So I put some not helpful things here, but you may think of helpful things too that you do or don't do in response to those emotions, like when you're feeling overwhelmed, jittery, anxious. Okay, meditate, that's great. Yoga, fantastic. Other people may procrastinate, stay in bed. They may find themselves arguing with their partner or kids. Great, listening to music. You guys are going to the adaptive side of things, tending to sleep, emotional eating. Thank you for sharing that. Yeah. And so then sometimes those things that we do contribute to the stressful situation. So avoiding the problem by sleeping may actually make the problem worse, or engaging in emotional eating may make you then feel worse about yourself afterward. I see a lot of people who eat to manage their emotions and then gain weight, and that makes them feel worse. And so then you can see how this becomes a spiral of stress that it's difficult to get out of. One thing leads to the next, and then you're just trapped in the spiral. And if that's how you're feeling right now, that is totally normal. This is something that a lot of people experience. And if you'll notice those words that you described, how you're feeling, many of them are actually about what's already happened or what might happen next. So worry and anxiety are words that describe things that, ways of reacting to thoughts about what's going to happen in the future. Whereas sadness is an emotion related to what's happened in the past. Something happened that made you feel sad. Overwhelmed is sort of about both what's happened in the past, all the things that have led to you feeling tired, but then overwhelmed is also about all the things that are you see coming down the pike for you, and it feels hard to contemplate how you're going to get everything done or keep up. Very few of these things are about what's actually happening right here now in this present moment. And so that's sort of the key to breaking out of this stress spiral, to bringing your attention and awareness here, now, into the present moment. So I'm going to lead you through an exercise now to practice this. This is my little icon to denote when you might want to record. So this is called a 5 senses exercise. And if you want to make a recording of these exercises, go ahead and start recording now. As I mentioned, this exercise is called the 5 senses exercise. It's widely available, and you can, if you Google this, you can get recordings of it online as well. I'll have you start by getting yourself into a comfortable position. You may be seated, standing, maybe you're even walking around right now, and that's fine as well. If you are seated, I would ask that you put both feet flat on the ground and sit up upright in your chair and see if you can balance your head on top of your spinal column. That tends to take some of the pressure off of your muscles to hold you upright. And relax your shoulders down. And I'll have you start by looking around the room that you're in. Notice where you're sitting, where the door is. There is one. There's a window where that is. Notice the lights in the room. I'll have you close your eyes now. And I want you to, in your mind, with your eyes closed, remember how many lights are in the room you're in. Now see if you can remember what color the floor is in the room you're in. If it's a room you're really familiar with, you probably know. All right, now you can open your eyes and look around and see if you were right. Next, I want you to pick a color. Let's say red. Look around the room that you're in and make a mental list or point out to yourself everything in the room that's red. I'll look around my room too. All right, now let's pick another color. Let's say purple. It's a bit harder. Is there anything in your room that's purple? All right. Now I want you to notice what you can hear in the room that you're in. If your eyes are open, try closing them now to see if you can hear anything else. Now notice what you can taste in your mouth. Maybe the coffee from earlier, something you ate for breakfast, your toothpaste. Now notice if you can smell anything. If you've been in the room a while, you may not be able to smell anything. Now see if you can notice how the air feels as it touches your skin. Does it feel cool or warm? Notice the texture of the seat on which you're sitting. Does it feel smooth or rough? See if you can just focus your attention on your fingertips without trying to describe in words how it feels. All right, let's take a deep breath together. In through your nose and out through your mouth. And in through your nose and out through your mouth. All right. So now you just connected with the present moment using your 5 senses. Anyone willing to share in the chat how you felt during that or what you noticed? Yeah, someone says that they felt present. What I often hear people say too is that they stopped thinking about all this stuff that we were just talking about. And that's exactly what this is for. It's like a little mental vacation. Yeah, someone said that it made them feel relaxed. And that can certainly be a byproduct of mindfulness, is feeling more relaxed. And here the idea is to focus your attention and awareness on this present moment. An easy way to access the present moment and to bring your attention to the present is through your 5 senses. So it's a little trick that you can use. And you can use it anytime you're feeling overwhelmed, but I also recommend practicing this as a skill, even when you're not feeling overwhelmed, so that it's available to you when you need it. But I teach this to physicians. I've taught it to surgeons, nurses in the hospital, who can use it sort of on the fly when things get stressful or tricky in the middle of a procedure even. And no one has to know that you're using it. I'm going to teach mindful breathing at the end of our session today. But with deep breathing, at least other people notice that you're doing it. So this is one that you can do sort of stealthily, and no one has to know that you're stressed. You can use it and do it within, a minute or two, or you can kind of make it a longer exercise like I just did for you now. But I would recommend that if you want to rely upon this exercise during a stressful time, that you find a way to build it into your routine. And we'll talk about that a little bit more in detail at the end today. But as I mentioned, this one is unlike deep breathing in that other people may not notice that you're doing it. And deep breathing is something that I actually get into trouble with, because at home, my kids can always tell when I'm feeling stressed because I start deep breathing. And my son said the other night, "Oh, mom's getting stressed." There she goes, deep breathing. So this is one that you can use anytime, any place. All right. So where does this practice of mindfulness come from? So it goes back to ancient practices of Buddhism and some even earlier practices before Buddhism. And it's a way of focusing your attention and cultivating an awareness. So those are the 2 core components of the ancient practice of mindfulness. But since that time, it's really become a core component of many modern psychotherapies. So, and I'll talk to you about how to find or access these different kinds of therapy at the end today. But mindfulness is a core component of mindfulness-based stress reduction, mindfulness-based cognitive therapy, acceptance and commitment therapy, and cognitive behavioral therapies, as well as dialectical behavior therapy. So it's really become a key component of different kinds of mental practices that are designed to reduce depression and anxiety. And research has shown that the benefits of daily mindfulness practice include a lot of different health benefits. So improved emotional well-being, like I said, reducing depression and anxiety, as well as irritability. It also makes your stress system, or HPA axis, more responsive to stress when it comes up. So it makes people report that they feel less stressed. It reduces blood pressure, reduces self-reports of physical pain, regulates the stress hormone cortisol, and improves cardiovascular health. Mindfulness also has been shown to increase cognitive performance. So people who practice mindfulness on a daily basis show improved attention and improved memory. We also know that mindfulness practice regulates the brain networks that are responsible for stress and depression. So if there are any neuroscientists joining us today, these words will make sense to you, and otherwise you can just let them wash over you. But it reduces the connection between this area of the brain called the posterior cingulate cortex and the dorsolateral prefrontal cortex. And that's important because these areas are hyper-connected when people feel stressed and depressed. And so reducing that connectivity is an important marker of the efficacy of mindfulness. All right, so now I want to dispel some myths about mindfulness because this is what I hear almost all the time when I teach people mindfulness. It does not mean clearing your mind of thoughts. And so a lot of people think they're failing at these exercises because they have thoughts that are creeping back in. And nothing could be further from the truth, actually. Mindfulness is really the practice of getting distracted and then refocusing your attention again. And so the more you get distracted, the more opportunities you have to bring your attention back again. And that is the thing that we're trying to practice with mindfulness. So it's great if you get distracted and notice it and then come back again. So it's not the case that we're trying to create some kind of Zen state where your mind doesn't have any thoughts. Mindfulness is not relaxation. So it may make you feel relaxed, and that's a great byproduct of practicing mindfulness. But some people actually feel a little more anxious when they practice mindfulness for the first time, in part because they're judging themselves and how they're doing, or because they're confronting thoughts that they usually try to avoid. I don't want this to be just one more thing for you to do or try to achieve. And we'll talk about ways to put this into practice. So hopefully it won't feel that way. And the goal here is not perfection. It's just practice. And that's something that I even have to remind myself as someone who's done mindfulness meditation for a long time. I still find myself feeling like, oh gosh, there's that thought again. Oh, why am I still having that thought? And that's really not what it's about. It's about noticing the thought and being able to let it be there. So more like this little boy at the ocean. This little boy is actually my kid. And this picture is from us at the beach in North Carolina. But I show this picture because I want you to think of thoughts and emotions like waves coming into the shore. So you have a choice about how to manage thoughts and emotions like the ones we were talking about earlier. And those emotions are serious emotions. Feeling overwhelmed sucks. It's a terrible feeling, right? And it's what's up for us right now. Some of us are feeling overwhelmed or tired or frustrated or exhausted or anxious or depressed. And if you'll notice, those feelings come in and then we can let them go back out again without any effort, just by being like this little boy and watching them come in and out again. Where we get into trouble with thoughts and emotions is when we try to go into the ocean and prevent them from coming in so that we don't feel those bad emotions. And so you can imagine that boy out in the water trying to prevent the waves from coming in, or trying to usher them back out and pushing the water back out. But the ocean is so much bigger than him and so much stronger, and he won't have much success at that. And he's going to get all wet and be much more stressed if he's out there thrashing around in the waves. And so what our goal is with mindfulness mindful awareness of our thoughts and emotions is to stand on the shore or even sit and watch the waves come in one at a time. That's so much easier said than done. It takes quite a bit of practice. And so that's what I'm here to help you with today, is to just learn some skills that you can use to do this. And then, put them into practice in your day-to-day life. All right, so the next exercise I'm going to teach is cultivating awareness with a body scan. So with this, I will have you once again put both feet flat on the floor if you're seated. Sit up straight in your chair and move your body around to find a place where you feel comfortable sitting. And when I practice, I just rest both hands in my lap. You can keep your eyes open or closed for this. I prefer eyes closed myself, but you may have a different preference, and that's totally fine. With this body scan exercise, I'm going to have you start at the top of your head, and we're going to work down slowly to your toes. In the Buddhist tradition, this is called Vipassana. But there's lots of different ways to do this, and it fits within many different religious traditions. So I'm not teaching anyone to be a Buddhist today. All right, so I like my eyes closed, so I'm going to do that. And I will start, like I said, at the top of your head. So we're just going to practice moving our attention to different parts of our body and being aware that we are the one noticing the parts of our body. So we're going to start with the top of our head and see now if you can hold your attention on the top of your head. Notice the feelings in your scalp and across your forehead. Notice if there's any tension in the skin, the muscles across your forehead. And see if you can just allow that skin to be smooth, relaxed. Now notice the skin around your eyes. We often carry a lot of tension in the skin around our eyes as we squint at our screens. And notice how you can let go of that tension just by bringing awareness to it. Maybe your skin smooths out around your eyes. And as you do this, you may notice that your eyes feel like they're floating in a pool of warm water. Now notice the feelings in the sides of your face, in your cheeks. Not trying to describe in words the feeling that you find there, but just noticing how it feels in your body. Notice the feelings in your cheeks. Now notice the feelings in your jaw. Allow your jaw to hang loose. Allow your tongue to float in your mouth. So maybe the tip of your tongue touches the roof of your mouth. And now notice the feelings around the back of your head and neck. Focus your attention on the sides of your neck and where your neck meets your shoulders. This is another place where people carry lots of attention, or carry lots of tension rather. See if you can notice that you can let your shoulders hang down, sink down, become very relaxed so that using no more muscle energy than necessary to remain sitting upright. Allow your arms to hang heavy at your sides. Notice the feelings in your upper arms. Now notice the feelings in your elbows. You may not think about your elbows very often. If you're wearing long sleeves, you can notice how your elbows touch the inside of your clothes. And if you're not, you can notice how the air feels as it touches your elbows. And now notice your lower arms. Allow your arms to be heavy in your lap. Notice your wrists. The feelings in your hands. Your fingers. All the way down to your fingertips. You may notice a slight warming or tingling sensation in your hands and fingers as you do this, which is just a sign of increased blood flow. Now notice the feelings across your chest. Notice how your chest rises and falls as you breathe in and out. See if you can just breathe slowly and naturally without trying to change your breath. Instead, just bringing attention and awareness to your breathing. Notice how your rib cage expands and contracts. Slowly and naturally as you breathe. If you're really breathing deeply, you may even notice the feeling across your back as your rib cage expands. Now notice how your belly moves with each breath. Now notice the feelings in your hips. Move your attention to your thighs. Notice the places where the bottom of your thighs touch the chair on which you're sitting. Just see if you can hold your attention there for a moment. If you get distracted by your thoughts during this exercise, just gently return your attention to the sound of my voice. It's perfectly normal to get distracted by thoughts. Next, turn your attention to your knees. See if you can notice how your knees feel as they touch the inside of your clothes or the air in the room. Next, notice the feelings in your lower legs, your calves, ankles. Notice how your feet are heavy in connection with the floor. Notice the places where your feet touch the floor. Notice the feelings in your toes. Again, you may notice a warming or tingling sensation in your feet, which is a sign of increased blood flow. Let's take a couple deep breaths together in through your nose and out through your mouth. And in through your nose and out through your mouth. Next, I want you to imagine you're walking out onto a beach, following the path out onto the beach. And you step on the sand. You can feel the sand underneath your toes. It feels warm. It's a nice sunny day. It's blue sky, blue waves coming into the shore. Now imagine lying back in the sand, looking up at the sky. Above you, you can see some clouds. Big and white and fluffy today. There's a gentle breeze. It's making the clouds float by slowly. Now I want you to notice the thoughts that come into your mind and practice putting them up there, either the words that you're thinking or the mental images you have, and putting them one at a time up on a cloud and seeing it there in front of you, not trying to get rid of it, not trying to push it away, blow it past more quickly. Instead, just noticing the thought there, up in the sky, one at a time. If you're feeling emotions, you can put those up on the clouds as well. Just allowing them to be there and getting curious about what you see. Just like your thoughts are like clouds, you are like the sky. You're the place where your thoughts happen, but you are not your thoughts. So much bigger. Your awareness stretches out as far as you can imagine. Your thoughts are just little clouds there. You don't have to feel too invested in what happens with them. They're there today. They're there right now. They may be gone moments from now. And days from now, you may not even remember them. Let's take another deep breath together, in through your nose and out through your mouth. Again, in through your nose and out through your mouth. If this place feels relaxing to you or peaceful, remember this feeling in your body. This place of peaceful relaxation is a part of you. You carry it inside of you everywhere you go, and you can return to it anytime that you need. If your eyes are closed, let's keep them closed. But bring your senses now back to the present moment. You can start by wiggling your fingers and toes, moving your arms and your legs a little bit, shrugging your shoulders, changing your posture a bit, remembering the room that you're in, where you're sitting, where the computer is, if you're watching on a computer, where the door is. Move your head around a little. And when you feel ready, you can open your eyes. Thank you for joining me in that exercise. I wonder if you might put in the chat how you feel now after having participated in that exercise. Hopefully I didn't put anyone to sleep. In graduate school, actually, when I was learning to do this kind of mindfulness and meditation practice, our instructor told us that we would only pass the class if we could practice it in a way that would put her to sleep. So our instructor would lay down on the floor, and our job was to do this in such a calm way that we would put her to sleep. All right. Yeah, someone says they feel calm. Yeah. Okay. Time for a nap. So hopefully now that you've woken up your body a little bit, you can refocus on the presentation, and hopefully it will feel as if you've already taken a nap. Great. Thank you for putting more things in the chat. feeling more relaxed and less stressed, calm and present. It's great. So this is another one you can return to anytime. You don't need a recording to do it. You can, if you made a recording of me today, you can use that. You can also Google body scan recording, and you can find a lot of these online. All right. So again, this is something that you can build into your day-to-day practice. People I work with tend to like to do this either first thing in the morning when they wake up, or last thing at night before they go to sleep, because it is pretty relaxing. It's a nice way to fall asleep at night instead of looking at your phone, or what so many of us do, reading the news or something before bed, which can be really activating and worrying. So this is a nice way to kind of wind down at the end of the day or start the day from a really centered place. I also work with folks who like to do this over lunch break. All right, so next, before we wrap up, I wonder how you might practice mindfulness in the next 24 hours. And I ask you that because I want you to be able to make the most of what you've learned so far today. I would recommend that you start small, maybe with just 2 minutes, and start today, like I said, within the next 24 hours or even later this afternoon. It works really well to pair it with an existing habit. So you could practice that 5 senses exercise, for example, while you're brushing your teeth, while you're taking a shower. Have people learn to do this by just being mindful while they're driving to work, or to school, and taking a walk, walking to class. You can, if you're doing it while walking, just feeling the ground underneath your feet while walking. You could practice by listening to one of the recordings from today, or finding a recording online that you really enjoy. And then I think about the things that might get in the way of you doing this goal. So before we get to the barriers, why don't you, if you're willing, put in the chat something you're willing to do to practice this today. Again, with a focus on starting small, starting today, and making it something that you actually can do. So we're not looking for something big. You don't have to download a meditation app and start meditating for 30 minutes a day. Just one small way of connecting with this, maybe doing that 5 senses exercise. Yeah, breathe for 2 minutes. Perfect. Yep. Body scan before I go to bed. Great. That's a really great goal. So something that might get in the way is that you might forget, because you have your normal bedtime routine, and it'll be very easy to forget to do this. So I recommend, if you're planning to do something later today, to set a reminder on your phone. If you just press on the iPhone, if you press the side button and hold it down, you can say, remind me to do a body scan at whatever time, 10 p.m. Many people probably go to bed earlier than I do, 8 p.m. Then your phone will just remind you to do it. If you want to set a daily reminder, you can set a calendar reminder, but I'd encourage you to go ahead and set your goal and set a reminder now so that you don't forget, because the biggest barrier to starting any new habit is just forgetting. All right, great. Wonderful. I'm seeing people saying that they're going to do this body scan before they go to bed. Wonderful. All right. So another just quick thing that you can do is mindful breathing. And so I like to do it with deep, long breaths. You can do it just as we did it during that body scan exercise, and just noticing your breathing in the place where you feel your breath the most. It might be in your nose, in the back of your throat, and your chest rising and falling, and your belly moving in and out. But one thing that I like to do to start is just have people put one hand up here on your chest with your thumb and index finger on your collarbone, and then your other hand over your belly button. And just see if you can notice which hand moves as you're breathing. Maybe both the hands move. Might be one or the other. Now notice what kind of breaths you have to take just to get that top hand to move while keeping the bottom hand still. You have to take really short, shallow breaths. And to me, that's what anxiety feels like. Really short, shallow breaths. I can make myself feel anxious just by doing it. Then now try to keep that top hand still and get that bottom hand to move as you're breathing. You have to take a slower, deeper breath. Now see if you can get both hands to move. And with this, you have to take a deep, slow breath. And by doing that, you're bringing the air all the way to the bottom of your lungs, expanding your rib cage out. And that nice deep breath actually regulates your stress system. So as your body gets stressed, all sorts of biological changes happen that are outside of your control. The one piece of the stress response that you can control is your breathing. And so you can actually just feel more peaceful by taking those deep, slow breaths, getting both hands to move as you breathe. And then the mindful component is just noticing how it feels in your body as you're breathing like that. And you could do that for even like 30 seconds or 10 breaths, and that can make a big difference. All right, so just one more way to practice mindfulness. All right, so today I went over 3 simple mindfulness tools that you can put into action today to promote pause, well-being, and restoration. And just to kind of summarize the things that we talked about, overwork has become the norm during the pandemic. It's associated with a number of negative health consequences. A daily mindfulness practice reduces these negative health consequences, and actually may help you be more mindful about your day-to-day and your life and making decisions to not be so overwhelmed in the long run. We set a daily practice goal, just starting today and seeing how it goes. We thought about some potential barriers or things that might get in the way, especially forgetting as you start this new habit. All right. So thank you for practicing with me today. We're going to do a Q&A, but before that, I wanted to point you toward these additional resources. So for students joining us today, the CAPS website has a lot of good information, and you can request to meet with a mental health professional by going there. If you're not a student, one great way to find these types of therapy that promote mindfulness is going to psychologytoday.com. One that's really focused on mindfulness meditation is mindfulness-based cognitive therapy. I've circled it here. Also, dialectical behavior therapy and acceptance commitment therapy include a significant mindfulness component. So if you like doing this and you want more help and guidance in how to apply this in your own life, that would be one suggestion. You can also follow me on Twitter. I tweet about mental health related topics, and so you can learn more there. So with that, I will go to the Q&A now. So please put any questions that you have in the chat or in the Q&A function. All right. I do not see any questions so far. Maybe you're typing.
Crystal, this is Amy. I believe that one of the things we did in advance was try to solicit a few questions. So I'm wondering if you might want to field one of those while we're allowing people to sort of ruminate on things that they might want to ask you.
Great.
One of the questions is pertaining specifically to depression and anxiety. How can one manage the side effects and in parents mood changes of taking prescriptions? Do you have any guidance on that? It's a very specific question.
Yeah, so all sorts of medications can have mood effects. There are potentially ways to offset this using behavioral approaches. So those kinds of therapies that I mentioned can really help people with dealing with the consequences or side effects of medications that cause mood changes. Mindfulness meditation could be a part of that. It may not get someone the whole way there, but therapy can really help, especially the behavioral therapies that I mentioned today. Um, but yeah, I mean, I think this is a challenge for sure, with more and more people being prescribed medications now. It can be tricky. There are also pharmacologic ways of managing medication side effects that cause depression and anxiety. So things like antidepressants can be also a good tool for people experiencing that.
Thanks so much. Another question that we received, and there may be some crossover here, is what advice would you give to someone who feels as though they are being affected by hormones?
Yeah, well, this is my area of research. So um, I have a lot to say on this topic, and it could be like a whole another lecture or class. But yeah, so for women, hormones change day to day. There are big changes that happen during adolescence. Then, when women take oral contraceptives, those cause more hormone changes. We see changes day to day over the course of the regular menstrual cycle. Big changes happen during pregnancy and the postpartum period. And then when women transition to menopause, it's sort of like a reverse adolescence where hormones are changing a lot day to day again. And some people are specifically or especially sensitive to the changes in hormones, whereas other people are not. Otherwise, everyone would get depressed during those hormone transitions. And that's not what we see at all, actually. There's a subgroup of people that are especially sensitive to hormonal changes. And we use a lot of the same behavioral techniques that I taught you today to help manage those hormone fluctuations and reduce the effects on mood and relationships. But there's also medications that can help depending on the time period that a person is in that I mentioned. Different medications might be prescribed. Sometimes those include antidepressants, sometimes they include hormones, and it just depends. There's not really a one size fits all approach because each person responds to hormones in a slightly different way. And so if a person came to see me in the clinic with those kinds of concerns, then I would have them track their symptoms every day over the course of the menstrual cycle, during pregnancy or menopause. And then we would look at their own unique pattern of mood changes relative to their cycle and design a personalized treatment program using behavioral stuff that I tend to do as a clinical psychologist, and then also potentially medications as well. People think that hormones just affect women, but they also affect men. And so there's really interesting research coming out about how testosterone levels change when a man becomes a father and how that impacts the brain and behavior. But that's true across a man's life. And so hormonal changes happen for men too. It's different than what happens in women, but it still happens. And there are some things that we can do to help when those hormone changes cause depression, anxiety, irritability, and other things.
Thanks so much for that. There's a question here, and I think this is beyond the sort of mindfulness piece and the pausing that we've talked about today. Are there do you have other advice or other strategies that you might recommend regarding how our community can recharge? And in particular, this question was focused in on midterms and finals, so very relevant to our community. Any other recommendations for recharging the batteries?
Yeah. So a lot of people think recharging is just about rest, and rest is certainly a big part of it, but self-care is bigger than rest. And self-care has sort of become this like buzz term that, marketers are now using to try and sell people things. But what I mean by self-care is just taking care of yourself the way that you would take care of like a toddler. So making sure that they get good rest, good healthy meals, regular meals. When we're stressed, we tend to skip meals. So eating regular meals is so important. Drinking enough water, getting outside in the sunshine really helps. Moving your body, whatever that might look like for you, getting some exercise. And then the key thing that I have found in my work with patients, but also has been shown in the literature, is building in something fun. And so I think, in our culture, the idea is we have to get through all the hard stuff, like get through all the midterms, get through all the finals, and then we can let loose and have fun. But actually, if you build in opportunities for fun and joy along the way, you get through that period of finals feeling less depleted. And it actually is protective against anxiety and depression. So that could be something really small, like, you know, throwing on your favorite music and dancing for 5 minutes, or texting your best friend, making time to call someone you love, watching like a funny video online. You actually get even more positive benefit by connecting with someone else around these moments of joy. So if you can build in a way for other people to share and joy with you as you do this, then you'll end up feeling even better.
I love that idea about sharing joy with people. That's a good one. I'm going to take that as a particular note.
Right.
There is a question in the chat. Someone is inquiring about issues with motivation, sleep, and overeating, and guidance that you might have for someone about who to talk to, how to approach this, what to say.
Yeah. So I think a lot of people are feeling issues with motivation right now. As the pandemic has worn on and, things are happening around the world, many people are feeling overwhelmed and tired and a lack of motivation. So I think one thing we can all do is talk with our friends. I think during the pandemic, one of the silver linings, if we want to call it that, is that people have been much more comfortable talking about mental health issues than ever before. Some of these issues have become less stigmatized. And so I think people are just more open and accepting of talking about mental struggles and just stress and some of these things. So turning to a friend and talking to them about how you're feeling can be a really great place to start. If you're feeling really overwhelmed or some of these issues are impacting your ability to function, to perform your normal routines, or they're causing you a lot of stress, the lack of motivation or eating issues, that might be a time to reach out for help. If you're a student, you can reach out to CAPS. If you're a member of the community, that psychologytoday.com resource is really nice because it showcases all the therapists in this area that are currently taking patients and their areas of specialization. And so you can search specifically for people who specialize in eating disorders or depression, anxiety. My only caution there is that if someone has a list of specialties that's more than like 10 things, it usually means that they're a jack of all trades and master of none. So I would caution against pursuing therapy with somebody like that. But usually somebody with a pretty targeted focused list is what you're looking for.
That's such helpful advice. This particular question strikes me as a twofer. In particular, one of the things that I know we work on university-wide is helping students identify what path their life might take after college. So this question is, can you tell us a little bit more about what motivated you to pursue a career in mental health? And in particular, then if I can add a side piece to that, which is, if there are students in the room or colleagues, frankly, who are thinking, this has really been fantastic. You have inspired me to think about this for myself. Is there any advice that you would have regarding, how to get started in the field?
Yeah, great. Thank you. Gosh, okay, so I took a high school psychology class. I was taking a lot of AP classes in high school, and I thought, I need something easy, and psychology sounds like it'll be easy. So I signed up for psychology. It wasn't easy, but I was just so fascinated by the topics. And I remember the high school teacher saying, during the section on depression, women are twice as likely to be depressed as men. And I sat there and thought, I don't, I don't know any women who are depressed. Like, the women in my life are strong and they get stuff done and they take care of everyone and everything. I grew up in a farming community in Iowa, and so the women that I grew up around were tough. And so I thought, that doesn't make any sense to me. How could that possibly be? And then I thought about it more, and that it's like all those emotions are there, but they're like inside and they're not coming out unless something really big happens. And so I just became fascinated by that. So I thought, I'm going to go to college and be a physician. So I went to the University of Iowa, which has a well-known medical school. And my guidance counselor told me, if you want any hope of getting into medical school, you've got to start volunteering at the hospital right off the bat. So I signed up to volunteer, and they placed me on the psychiatry inpatient unit as my volunteer experience. So I was tutoring girls who were hospitalized for eating disorders. And it was an extended stay program, so they were missing a lot of school. So I was tutoring them in the school that they were missing. And I became really interested in why all the patients were girls, and why we didn't have any boys on our inpatient unit struggling with eating disorders. So I decided to abandon the idea of going to medical school and get a degree in clinical psychology so I could study this. And my theory at the time was that it was hormones. And so I started studying hormones and eating disorders, which ended up being my master's thesis in graduate school. But then I found that, the effects of hormones are much broader than just eating behavior. They really impact almost everything we do: motivation, our moods, thoughts, and feelings. And so I expanded my area to really study all of these things. And that's how I got into doing what I'm doing now. Advice, I think, would be to just follow the things that interest you. That's what I did, and it worked out pretty well for me. I get emails from undergraduate students all the time asking how they can get involved in this kind of work. And there are lots of opportunities in the psychiatry department to get involved in research. And that's really the best way to get involved as an undergraduate, because I can't teach undergrads to do direct patient care. You have to have a license and a degree for that. But research is a good entry point. And in my research lab, our undergraduate students talk to research participants, do assessments for depression and mood, and then help us collect data. We do brain imaging studies. So they learn about how to collect brain imaging data and how to, do phlebotomy, so drawing blood, and how to process blood for assaying hormones. And so there's lots of opportunities like that all across the psychiatry department, as well as in the psychology department. There are all different aspects of research that students can get involved with.
That's wonderful and great advice. One of the great assets that we bring to our students as a, public global research university are these research opportunities. And I strongly encourage folks to, particularly at the undergraduate level, get connected with our undergraduate research center to help find those sort of points of connection. And also our career center, our university career center can be a great source to be able to go and link some of your interests in these things that you may be passionate about and find potential career paths or opportunities. So really appreciate that. Some great insights. Well, Dr. Crystal Schiller, thank you so much for all of your time today. I don't think we have any other questions in the chat or the Q&A, so we'll get everybody out just a few minutes early today. But we've learned a tremendous amount, and in addition to being an educational experience, we're, I think, all taking home some very specific tools that we can use in our lives. So it's just, really been a wonderful day, and I thank you so much. I'd also like to thank Ashaya Campbell and Sarah Stallman and Allison Reed behind the scenes for making this particular program go today. And just to remind folks that, as Dr. Schiller said earlier, one of the goals of this particular effort for our community is to help reduce stigma and keep the conversation going. And so we encourage you to come back to our Heals Care Network website at care.unc.edu to be able to check out the recording of this particular event, to be able to see, if you weren't able to join us for our mental health colloquium last month, you can see our session there that we did about race and identity and the intersection with mental health. And you can also on that Heals Care Network website see more events that are upcoming. We have a UNC Wellness Fair later this month on the 17th. And then our next mental health seminar will be about understanding emotions and how to talk about them from our School of Social Work. Our own Rachel Rifkin will be guiding that particular effort. That's coming up on November 16th. So again, thank you so much, everyone, for joining us today. Thank you so much to Dr. Crystal Schiller for a wonderful session. And we will look forward to hopefully seeing you at the next one. Take good care, everybody.
Thank you.